Hello learners, I send my greetings to you once again. Welcome to our fourth topic in health wellness unit. I'm your facilitator, Anastasia Kamwendia, who will be taking you through this topic. I hope you are enjoying all the topics that we are having and we are learning is taking place. So in this topic, we are going to look at diabetes. You've heard of the diabetes. And there are different types of diabetes, but in particular, we are going to look at one that we call the diabetes mellitus, which is the most common type of diabetes. So this is the most common types of diabetes that you will find. So we expect you, by the end of this topic, to understand diabetes. We also need to understand why it's normally called a metabolic disorder. We also want to understand what causes it. What causes diabetes? Because in this topic, we are looking at things that we can be able to prevent. Can we prevent diabetes? So we are also going to look at the risk factors so that we can be able to prevent diabetes and where there is need to detect diabetes early so that we can be able to manage it. So we say, as an introduction, we say that diabetes mellitus is a group of metabolic disorders characterized by elevated levels of glucose in the blood. This one is a scientific word we normally use, hyperglycemia. Hyperglycemia, that is the elevated levels of glucose in the blood. It normally results from defects of insulin secretion or insulin action or both. The insulin, the cells that produce insulin, they could have defects, or the body itself could be having a problem with utilization of this insulin. That's what we are talking about. We find diabetes is a major cause of morbidity and mortality resulting from related diseases that develop from the chronic diabetes mellitus or the long-term effects. These ones include diseases of the large blood vessels, which we call macrovascular disease, including coronary heart disease. We've all heard of coronary heart disease, and peripheral arterial disease. And also there are diseases of the small blood vessels, which we call microvascular disease, including the retinal and the renal vascular disease, and the diseases of the nerves. These ones are all caused by chronic diabetes. So as we have said, it's a metabolic disorder, and it is normally marked by high blood glucose because the body is not able to utilize the glucose, or the levels due to the insufficient insulin, or the body is producing and there is no insulin to work on this glucose, or there is insulin resistance. So there are key symptoms that we need to know that can tell you that one probably be having diabetes. And these key symptoms include excessive urination, the urge to pass urine many times, what we call polyuria. There is also increased thirst, what we call polydipsia. And also there could be unintended weight loss. We know there is that weight loss that you work towards reducing your weight, but this other one just comes, you just find you are reducing your weight, and then fatigue. So in this case, one has noted this from the self or from a friend or a relative. They need to go to hospital so that they can be diagnosed. And diagnosis is confirmed by elevated sugar. When you go and the tests are done, you find there is elevated sugar in the body. We say insulin is a hormone secreted by the beta cells, which are located within the clusters of cells in the pancreas. And these ones, we call them the islets of Langerhans. And the insulin law in the body is to trigger the cells to take up the glucose so that the cells can use this energy. In this case, it yields sugar and also to control the level of glucose in the blood. So this is done by regulating the production and storage of glucose. So patients with diabetes may have dysfunctional beta cells, the ones that we have said they are in the pancreas. the body may be able to, may have dysfunctional beta cells, resulting in decreased insulin secretion, or their muscle and adipose cells may be resistant to the effects of insulin. So resulting in a decreased ability of these cells to take up and metabolize glucose. So that's what will cause diabetes. So in both cases, the levels of glucose in blood increase, causing hyperglycemia. The word we use for high blood sugar, that is hyperglycemia. As glucose accumulates in the blood, excess levels of this sugar are excreted in the urine. That is why to test the sugar, we can use a urine sample or a blood sample, because you have high blood sugar in the urine. The urine may have high sugar or in the blood. So because of greater amounts of glucose in the urine, more water is excreted with it, causing an increase in urinary volume and frequency of urination as well. When you urinate a lot, you'll also feel thirst many times. So other symptoms of diabetes include itching, hunger, weight loss, and weakness. So the key factors for developing diabetes mellitus, some of them we said some of them are the modifiable ones, because being overweight or obese is one of them. The other one is being physically inactive. We realize as one progresses in age, from 45 years older, you are more predisposed to getting diabetes. We also find there are these people with a family history of diabetes. If a very close relative, a mother, father, sister, or brother, or a child has diabetes, you are likely to get diabetes. And also people who have had a history of gestational diabetes. As we go on the topics, we are going to see what gestational diabetes is. So other contributing factors are high blood pressure. People with a condition called high blood pressure or hypertension, they are likely to have, they have higher chances of getting diabetes. High cholesterol level, unhealthy diet, like we said earlier, the one who takes an unhealthy diet. Then certain ethnicities and conditions like what we call polycystic ovary syndrome or PCOS. There are also other environmental factors that can lead to diabetes, like sleep disturbances, chronic stress, and alcohol consumption can also increase the risk. So this is where we are saying now some of the diabetes risk factors can be managed through behavior change, such as being more physically active, eating well, that we can control some of these things. Otherwise, other risk factors can't be changed, such as family history and age. So we need to find out what kind of risk do we have for diabetes from our family. Let's know our families well. So in the management of diabetes mellitus, we find diabetes mellitus is a chronic disease which is difficult to cure. Once it ensues, we cannot really say that one can get cured. So there are medicines that one is normally put on. They are supposed to take this medicine all the time, but the medical emphasis is on managing or preventing possible short-term and long-term diabetes-related problems. So this includes now managing the diabetes itself. Then we had said in our expectation, we wanted to see the types of diabetes. The first type that is most common is type 1 diabetes. That is diabetes, what we call the diabetes mellitus, caused by the autoimmune destruction of the insulin-producing beta cells in the pancreas. So this one leads to an absolute or near absolute lack of insulin in the body. Then we have type 2 diabetes mellitus, which is characterized by insulin resistance, where the body cells don't respond normally to insulin. So the body is producing the insulin, but the cells of the body are not responding to this insulin. Then we have the gestational diabetes mellitus. This one develops during pregnancy, often due to the placenta releasing hormones that cause insulin resistance. So those are the main types of diabetes. We've actually, earlier on, we've talked about the symptom of diabetes, which is said polyuria, frequent and excessive urination, polydipsia, excessive thirst, polyphagia, increased thirst, increased hunger, and explained weight loss, and then fatigue and lethargy, and increased susceptibility to infections. So when you go to the hospital, there are those tests that can be done, the urine test and the blood tests, some of which are maybe a fasting blood sugar. You've been fasting for more than 8 hours. They take your sugar, your blood, and check the sugar, or even a urine test. That one can tell, you will find sugar in the urine. And we have said now managing this is a lifestyle, adopting a healthy diet, regular physical activity, maintaining a healthy weight. These ones are very crucial. Then there are medication. Most people require medication to help lower the blood sugar levels. And earlier on, as we were introducing, we talked about the complications, which we said it is chronic hyperglycemia. This one can damage, the chronic hyperglycemia can damage blood vessels and nerves, leading to kidney disease, eye damage, retinopathy, which is the nerve damage, and increased risk of heart attack, and also stroke. People with this condition can also get stroke. So we expect that you do all the learning activities in this topic, and always remember to click and submit if you need any assistance. Yeah, I have my contacts there. Kindly contact me. So otherwise, welcome to acquire knowledge on diabetes and its management. Thank you very much for listening, and let's continue and do the topic.